Hey, Public Health on Call listeners. I'm producer Lindsay Smith Rogers, and this is a special episode of the podcast that we're calling Public Health in the Field. For this episode, we turn the mic over to guest hosts who bring us interesting perspectives from the front lines of public health. Today, you'll hear from Elisa Chul and Annalise Winnie. Elisa is a journalist and current MSPH student at the School of Public Health. Annalise Winnie is an associate editor for Global Health Now, a daily email newsletter that curates everything you need to know about the pressing global health news of the day. Elisa and Annalise wrote, recorded, and helped co-produce this episode about an upcoming Supreme Court case with major stakes for the future of abortion rights in the United States. Let's listen.
Today you're listening to a special episode about a particularly charged public health topic, abortion. And we're doing things a little differently this time. Today we're going to be taking you to Mississippi, in the heart of America, where there is a potentially landmark battle brewing over abortion rights. My name is Elisa Chul.
And I'm Annalise Winnie. We've both been journalists for several years, but this is our first time hosting the podcast, so thank you for coming along for the ride. We have a lot of ground to cover today, so let's get started.
December 1st is the day that the U.S. Supreme Court is going to hear Dobbs v. Jackson Women's Health Organization. The outcome of this case could upend some long-standing protections established by Roe v. Wade in the 1973 landmark case which legalized abortion nationwide.
Absolutely pivotal moment in reproductive rights, period. It's really not hyperbole to say that the threat to reproductive rights and abortion care has been amplified and relentless, and has been for the last decade, but really amped up this year.
That was Jenny Ma, senior staff attorney for the Center for Reproductive Rights, the group representing Jackson Women's Health Organization, the state of Mississippi's only abortion clinic. And so how did we get to this point? Let's go back to 2018, when the Mississippi legislature passed a law known as House Bill 1510, banning abortions after 15 weeks. There are exceptions if the life of the baby or parent are at risk, but not in cases of rape or incest. The law violated Roe v. Wade, which protects the right to abortion prior to viability of the fetus, which is at around 24 weeks. House Bill 1510 caused an outcry, and it was quickly blocked by lower federal courts. But over the last few years, as the case was making its way through the court system, several other states have tried to pass similar or even more restrictive bans on abortions. Now, the law's fate is up to the Supreme Court.
And this is among the first abortion cases the Supreme Court is hearing since the death of Justice Ruth Bader Ginsburg, who was a staunch supporter of abortion rights. She was replaced by Justice Amy Coney Barrett. And how Justice Barrett will vote on this specific case has yet to be seen, and that's part of what makes the stakes so high with this upcoming case. We'll talk a little more about what we've seen with this court so far with cases like the U.S. versus Texas, but first, Elisa's going to take us to ground zero for this fight. At Pepto-Bismol Pink Building in the heart of the Fondren neighborhood in Jackson, Mississippi's capital.
It's 8:15 in the morning, Jackson, Mississippi. I'm sure Fondren is excited about those street preachers at 8:15 in the morning. You think? I know I am not. I'm not excited by that at all. But they cranked up at 8 o'clock pretty much with a bullhorn on a stick.
What you're hearing there is a pretty run-of-the-mill weekend morning at the Jackson Women's Health Organization, also known as the Pink House. You have anti-abortion protesters wielding megaphones on the sidewalks outside the clinic. They usually carry these huge signs with graphic, bloody pictures of mangled fetuses. And that music blasting, that's from a group of volunteers who call themselves the Pink House Defenders. They walk patients between the cars and the clinic, and they do more than that too.
Most clinic escorts are trained to have no engagement whatsoever with the protesters. They are not to talk to them, and at certain clinics, they're told not to even look at the protesters. I've seen escorts turn their backs on them. We think that's counterproductive, and with the blessing of our clinic director, we do anything short of physical contact to divert their attention, drown them out, whatever need be to keep their attention away from the patients.
That's Dorinda Hancock. She began volunteering with the Pink House Defenders in 2013 on the 40th anniversary of Roe v. Wade. Now she helps coordinate about 26 volunteers. Hancock described to me a typical scene at the clinic.
And there was a woman who pulled in, and after she saw them on their 1,200-watt speaker screaming and the signs they put out, she pulled into the parking lot, pulled in really fast and super crooked, and she was just crying like crazy. I went up to her and, of course, they're screaming, "See, you're not sure you want to do this. That's why you're crying." And she was really just terrified of them. She had no idea that all this would be happening outside of her doctor's office.
It can be mayhem.
So let's cut through the noise. Elisa, what actually goes on inside the Pink House?
The Jackson Women's Health Organization is the only licensed abortion clinic left in the entire state of Mississippi and serves about 2,500 patients a year. Abortion is the primary service the clinic offers, both through surgical procedures and medication, and the clinic also offers ultrasounds and contraceptive care. I like how you said to cut through the noise, because there is a ton of noise in this debate, which is really about abortion access and the rhetoric surrounding reproductive rights. I think what often gets lost in the mix is the evidence. What are the real-life impacts of abortion policy on parents and families? What does public health have to say on the matter?
My name's Joanne Rosen, and I'm a senior lecturer. I work in the Department of Health Policy and Management at the Bloomberg School of Public Health. I'm also the associate director of the Center for Law and Public Health.
Rosen talked about the findings of a 10-year study, which followed nearly 1,000 women who either had or were denied abortions. The Turnaway study, done by Advancing New Standards in Reproductive Health, tracked the mental and physical health effects and the financial impacts.
What they found was much greater economic hardship among women who were denied wanted abortions than in women who were able to obtain these abortions, in terms of high levels of household poverty, higher levels of debt, more evictions, higher bankruptcies, but a great deal more of economic hardship and economic instability. The Turnaway study also found that women who were seeking but unable to obtain abortions endured higher levels of physical violence for the men who had fathered those children. And people who were turned away when seeking abortions endured more serious health problems. There are many other disparities between people who were able to obtain abortions and people who weren't, but that gives you a sense of the ways in which being unable to obtain abortions had really long-lasting impacts on those people's lives.
And here Professor Rosen is discussing a study that reflects on a lot of evidence in the field that safe access to reproductive health care means people have healthier lives and healthier families. A 2020 study in the American Journal of Preventive Medicine found that women living in states with less restrictive reproductive health policies were less likely to give birth to lower weight babies. Other research published in The Lancet found that restrictive abortion laws actually mean a higher rate of abortion-related maternal deaths, even in countries like the US with access to health and emergency obstetric care. Now, these laws affect more than just the health of individuals and families. They affect the economy too. Research from The Lancet found, quote, ensuring women's access to safe abortion services does lower medical costs for health systems, end quote. The Institute for Women's Policy Research has a host of data around how reproductive health restrictions also impact women's earning potential. And it's also important to note that abortion restrictions disproportionately affect people of color and those with low incomes. Rosen says that, according to data from the CDC, Black women are 5 times more likely to have an abortion than white women, and Latinx women are 2 times as likely as whites. 75% of people who have abortions are low income or poor. And as a side note, I use gender terms here because that's how the CDC recorded its data. So when you think about how this research has shown that people denied abortions face more economic hardship, higher levels of intimate partner violence, and more health problems, you really have to think about how that's compounding these existing disparities.
But the state of Mississippi and anti-abortion advocates have a different story. The person at the center of this Supreme Court case is Mississippi Attorney General Lynn Fitch. She was not made available to be interviewed for this episode, but she has penned op-eds and done other interviews that make her position clear. A key part of her argument is, essentially, that times have changed for women and their prospects in the decades since Roe was enacted. Here's a clip of Fitch talking on the Eternal Word Television Network's Pro-Life Weekly segment.
They have all these new and different opportunities that they didn't have 50 years ago. You can have these beautiful children and you can have your careers. And so that really gets us into how do we empower women?
According to a 2021 article by the Mississippi Free Press, Attorney General Fitch claims that the, quote, pro-abortion rights side ignores the plight of women and children in poverty. Fitch says she supports empowering women and families and lifting them out of poverty. And then she goes on to say, quote, ending Roe v. Wade would empower women to pursue careers and have babies. She often uses the hashtag Empower Women Protect Life on social media.
Right. And on its face, maternity leave and affordable childcare are core parts of dismantling health disparities. The problem, says Lori Bertram Roberts, is that Mississippi has a very poor track record providing such safety nets.
So I don't see any of the policies that would make what she's talking about possible coming down the pipeline from them.
Bertram Roberts is the co-founder of the Mississippi Reproductive Freedom Fund and executive director of the Yellowhammer Fund in Alabama, which operates across the Deep South. These organizations help people pay for abortions and get to clinics, but also helps them pay for contraception and offers parental supports like diaper subscriptions and school supplies. Many of the calls they receive are from people, most of them Black, who don't have Medicaid or any other type of insurance. Many of them have complex health histories or are trying to escape domestic violence, economic abuse, and reproductive coercion. For example, Bertram Roberts told me that it's not unusual for her to see clients whose partners have stolen their birth control pills and flushed them down the toilet.
The fact is, many of the states with the country's most restrictive abortion laws have the least amount of investment in programs for children, parents, and families, Mississippi included. Mississippi has the highest infant mortality rate in the country, and Mississippi officials have misappropriated millions of dollars from a federal program called Temporary Assistance for Needy Families for things like a new volleyball stadium or even luxury vehicles for a private school owner. And we know that from an investigation by news outlet Mississippi Today. And there's more. Expansions to Medicaid for new moms was blocked by the Mississippi legislature this year, and Governor Tate Reeves cut off federal pandemic unemployment aid early on. And back in 2018, when Reeves was lieutenant governor, he blocked 3 amendments that would have provided child care benefits for people who decide to continue with pregnancy after considering abortion between 12 and 15 weeks gestation. That's according to an investigation by the Mississippi Free Press, which has reported extensively on this issue.
So, Elisa, on December 1st, the Supreme Court will hear this case concerning Mississippi's very restrictive abortion law that bans most abortions after 15 weeks. Do we have any idea how the justices may approach the case and if they'll decide to uphold the law, which would endanger Roe v. Wade?
We can't say for sure which way the court will vote, but Rosen thinks it's unlikely the court would agree to hear the case if they were just going to affirm the status quo. They might make a decision that retains Roe v. Wade as the law of the land, but give states more leeway to restrict or ban abortion at earlier stages of pregnancy. Or they could completely abolish Roe v. Wade, opening the door for many, but not all states to ban abortion. 10 states have so-called trigger laws already in place that would fully abolish abortion in the event that Roe is overturned.
And that would certainly make access even harder for people seeking abortions, especially poor people and people of color. Ever since 1973, when Roe v. Wade became law, states and courts have been whittling away access to abortion in many parts of the U.S.
A huge swaths of the South and the Midwest, this is an abortion desert. The whole time I've been doing this work in Mississippi, our callers, our clients have been driving routinely 3, 4, 6 hours to get care. And that's been the whole time I've been doing this work. So this isn't new. This access issue has been ongoing. It's just making it very extreme and to a point where people can't ignore it.
Many abortion rights advocates will tell you that legal access is the floor to abortion rights. It's not the ceiling to aspire to. And what we're talking about now with these Supreme Court cases is not just this gradual whittling away. We're looking at the very real possibility of the end of abortion access in some 15 states. We're looking at a state of urgency that has not been seen in nearly 50 years. So that brings us to when this might happen. Elisa, is there a time frame in mind for how this could all play out?
We don't have an exact date, but Rosen has a pretty good guess.
So while a great deal is unknown about how this case will be decided, one piece that seems to be a lot easier to predict is when the court is likely to release its opinion. Typically, in its most high stakes or controversial cases, the court releases its opinions toward the very end of its term, which is in June, late June.
It might be earlier than that, but the reality is we likely won't know the future of Roe v. Wade for another 6 months. It's a long time to wait while so many things hang in the balance.
Right, and Dobbs v. Jackson Women's Health Organization is not the only case that's going to be reshaping the debate on abortion access in this country. You can't Google the abortion debate these days without hearing about Texas. So how does that fit into the picture?
Great question, Annalise. Texas made huge waves earlier in 2021 for being the first state to enact a ban on abortion after only 6 weeks of pregnancy. That's a really extreme abortion restriction because most people wouldn't even know they're pregnant at 6 weeks. Other states, including Mississippi, have tried to pass 6-week abortion bans in the past, but they have all been struck down by lower courts. So when Texas's high-profile law came before the Supreme Court on November 1st, that was a huge deal too. When I spoke with Professor Rosen, she said that it's important to note that the Supreme Court didn't actually address whether the 6-week ban, the substance of the law, is constitutional. The question they were looking at has to do with where, when, and by whom the Texas law could be challenged. So it was about the unusual enforcement scheme of the law, not the contents. As for how it might impact the Mississippi abortion case, justices might compare the Texas law with the Mississippi law. When you're looking at the effects and implications of a 6-week ban, it makes a 15-week ban seem, well, less extreme, maybe more reasonable. The Texas ban could give the Supreme Court some cover in potentially upholding Mississippi's 15-week ban. It's something to look out for when the Supreme Court hears the Mississippi case.
Right, and getting back to public health, when it comes to abortion access in states with the strictest laws, these legal battles will have consequences.
There is a lot at stake for health here, and we'll be watching on December 1st and in the coming months to see what happens.
Thanks for joining us for Public Health in the Field. I'm Annalise Winnie.
And I'm Elisa Toole. Thanks so much for joining us.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.